When you step into the healthcare system, maybe for advice, a diagnosis, treatment, or even rehabilitation, you're actually entering this complex web of care pathways.
That's right, interconnected steps.
Exactly. And what might surprise you is just how vulnerable these pathways can be. I mean, did you know that up to 4 out of every 10 primary care patients might experience some form of harm?
It's a staggering figure, isn't it? Especially considering how often most of us interact with primary care.
It really is. Welcome to the Deep Dive, where we sift through the latest research and insights to bring you the most important nuggets of knowledge. Today, we're diving into a really crucial topic: patient safety within clinical processes globally.
Yeah, and it's easy to think of patient safety primarily in terms of, say, hospital mishaps. But our source material quickly shifts that perspective.
Right.
It reveals a challenge that's far broader. It encompasses everything from how we manage medications to mental health services, and like you just highlighted, especially primary care, that often flies under the radar.
Our mission today, then, is to unpack the global strategies and initiatives being used to assure patient safety, maybe celebrate where progress is being made, and critically, pinpoint the areas that still desperately need our attention. Okay, let's dig in.
Let's do it.
So, where do things stand globally when it comes to the safety of clinical processes? Our sources seem to paint a pretty clear picture.
Well, the overarching goal is simple, really. Ensure safety at every single step of patient care. A comprehensive survey across 108 member states gives us a kind of baseline.
Okay.
The global score for clinical care safety stands at, well, a moderate 63 out of 100.
63, so moderate.
Exactly. This tells us that while many foundational safety programs are definitely in place, there's still significant ground to cover to fully meet safety standards right across the board.
What's really striking, though, is that about 4 out of 10 countries have actually launched their own patient safety improvement programs, each tailored to their unique needs.
Context specific.
And guess what their top priorities are? Healthcare-associated infections, HCAIs we call them, and medication errors. They're at the forefront of most of these initiatives.
And if we look at the bigger picture, we see some distinct patterns emerging from the data. For instance, measures for the safety of medical devices, medicines, blood, vaccines, they're relatively strong. Most standards are being fully met there.
That's good news.
It is. However, patient safety in primary care and during transitions of care, when patients move between different healthcare settings, that lags significantly.
How significant?
Only 26% of criteria fully met in those areas.
Wow. That stark contrast really makes you wonder, doesn't it? Why such a disparity in focus and, well, success?
Precisely. And it's not just what areas are prioritized, but where they're prioritized. The data shows the European and American regions generally have more robust scores across most safety strategies.
Yeah.
But countries in the African region, they tend to score lower, particularly when it comes to those risk-prone clinical procedures.
And income levels play a role too, I imagine.
They do. We see that higher-income countries generally perform better in overall clinical safety. But here's the kicker.
There's always a kicker.
Patient safety in primary care and care transitions remains a global challenge. It affects all income groups.
So it's a shared struggle. Really highlights where global efforts need to converge, doesn't it?
Absolutely.
Okay, let's hone in on some specific areas then. Maybe starting with those risk-prone clinical procedures. Our sources emphasize how crucial it is to identify where these potential sources of harm actually lie.
It's critical. And while a good number of countries, about 41%, have initiated multiple programs to tackle key safety concerns, far fewer, only about 1 in 4, report having actually identified the major sources of significant patient harm within their own local contexts.
Only 1 in 4, that seems low.
It is. And this gap is even more pronounced across income levels. While around a third of high-income and upper-middle-income countries have pinpointed these risks, that number just plummets to about 1 in 10 in low-income and lower-middle-income countries.
1 in 10. So where are most countries putting their effort then, if not always, on identifying the root causes locally?
Well, it seems they're largely focusing on the most, let's say, visible and immediate threats. Healthcare-associated infections, the HCAIs, are being addressed by over 80% of countries.
Okay, a high number.
And medication errors by nearly as many, around 78%.
Also high. But
But here's a sobering thought. Diagnostic errors, which we know can profoundly impact patient outcomes, they're only being tackled by less than half of countries, about 47%.
less than half. And mental health safety.
Even lower, a mere third, 36%.
Wow. That really begs the question, doesn't it? Are we focusing on the most visible problems rather than perhaps the ones that might have the biggest long-term impact?
That's the question the data raises. And priorities also shift with a country's income level, which is interesting. For instance, lower-income countries often prioritize things like sepsis and unsafe injection practices.
Understandable.
Lower middle-income countries focus more on surgical complications. Upper middle-income countries are often battling HCAIs, and high-income countries frequently focus on preventing things like patient falls.
Interesting how those priorities differ. Now, speaking of surgical complications, our sources feature a really powerful yet simple tool, the WHO Surgical Safety Checklist.
Ah, yes, the checklist, launched back in 2009.
That's the one. It's a 19-item, low-cost solution designed to decrease errors and adverse events and, importantly, improve teamwork in the operating room.
And it initially showed remarkable results, didn't it? Cutting mortality and morbidity quite significantly, especially in low and middle income countries.
It did.
What's interesting, though, is that even with sort of variable results in some later studies, the checklist's widespread adoption really speaks volumes about its perceived benefits.
People keep using it.
Exactly. Even partial implementation has shown improvements in those crucial non-technical skills, like communication between team members.
But it's not a silver bullet, right?
Right. Definitely not. The sources make it crystal clear. This checklist alone can't magically transform patient safety culture. It needs to be part of a bigger picture,
Supported by what?
supported by standardized care pathways, comprehensive training, strong leadership buy-in, and, crucially, adequate equipment and infrastructure. In fact, some countries like the UK, Brazil, France, they've actually made its use mandatory.
Right, embedding it system-wide. Okay, next up, let's explore medication safety. This is a huge area, one that WHO has highlighted with its Medication Without Harm Global Patient Safety Challenge.
It's absolutely massive.
Yeah.
Medication-related harm accounts for up to half of all preventable harm in healthcare worldwide.
Half? That's incredible.
It is. And errors can occur at any stage, really. From the moment a prescription is written, to dispensing, administering, and right through to monitoring. Often it's due to systemic weaknesses, human factors like fatigue or burnout, poor work environments, or just staff shortages.
So the Medication Without Harm Challenge,
Yep.
what's the main goal?
It's ambitious. The aim is to cut severe, avoidable medication-related harm by 50% globally.
50% reduction. That's certainly ambitious. And the challenge focuses on 4 key areas, I believe.
That's right, 4 domains. First, patients and the public.
Okay, involving us.
Exactly. The idea here is to empower you, the patient, to take an active role in your own medication safety. The WHO's 5 Moments for Medication Safety tool is a fantastic example.
What does that do?
It prompts you to ask crucial questions whenever you're starting, taking, adding, reviewing, or stopping any medication. Simple questions, but powerful.
Good practical tool. What's the second area?
The second focuses on healthcare professionals. It emphasizes the need for enhanced competence and performance. Patient-centered multidisciplinary teams are seen as essential for improving teamwork and communication, especially during those tricky transitions of care.
Makes sense. And the third?
The third is medicines as products. This tackles issues like, say, misleading drug names, confusing labels, or even poor packaging design. Stronger regulatory action on these aspects, combined with proper logistics and storage, can significantly reduce errors.
Right. The physical product itself. And the last one.
And finally, the fourth area, systems and practices of medication. This underlines the importance of having well-designed, resilient healthcare systems.
What does that entail?
It includes fostering a blame-free environment for reporting errors and near misses, so we can actually learn from them. It also means promoting research into medication safety and using standard operating procedures, or SOPs, to guide care consistently.
Okay, 4 big domains. Now, something that really stands out from the sources, nearly 3/4 of countries have endorsed this Medication Without Harm challenge. That sounds positive.
It is positive endorsement, yes, but their priorities within the challenge vary quite a bit. Most tend to focus on the regulatory aspects and maybe education campaigns.
Which are important, but
But areas like truly involving patient organizations in a meaningful way, or building professional capability right there at the point of care, those are often relatively neglected. And that's arguably a missed opportunity for comprehensive improvement.
yeah, getting it down to the front lines. Our sources also identify 3 critical action areas for countries to prioritize within medication safety.
Yes, the 3 key areas. High-risk situations is the first one.
Like what?
This includes things like high-alert medications, drugs that can cause serious harm if misused, or focusing on particularly vulnerable patient groups. The second is polypharmacy.
Taking multiple medicines.
Right, technically taking 4 or more medications. It's quite common, especially in older adults managing multiple chronic conditions. And the third is transitions of care.
We mentioned those earlier, high-risk points.
Exactly. Those moments when patients move between different settings, like hospital to home, which often create dangerous communication gaps about medications.
Okay, high-risk situations, polypharmacy, transitions of care. So it makes you wonder, how many countries are actually tackling all three of these major concerns simultaneously?
Well, the data shows only about a quarter. 27% of countries reported taking action on all three key areas,
Only a quarter.
though most are focusing on at least one. High-risk situations seem to be the most common priority, addressed by about 69% of countries.
Okay. Now, one surprising detail, at least to me, from the sources, is the focus on traditional and complementary medicines, or TCMs.
Yes, TCMs.
While they might contribute to overall wellness for some people, the sources point out they aren't always safe. They can have negative health consequences, things like allergic reactions or even dangerous interactions with conventional medications.
That's a crucial point. And despite more than half of countries including TCM-related adverse events in their pharmacovigilance, their monitoring systems,
Yes.
only a small fraction fewer than 1 in 5 countries have actually set specific safety standards for these TCM products and practices.
Fewer than 1 in 5, that highlights a significant gap in oversight, doesn't it?
It really does. And it ties into the broader issue of comprehensive reporting of all adverse drug events, or ADEs. This is vital for learning.
So how are countries doing on ADE reporting overall?
Well, most countries, 94%, have some form of ADE reporting system, but the depth varies hugely. Only in high-income countries do about 3/4 report all ADEs, including errors and near misses.
And in lower-income countries?
In lower-income countries, that figure drops dramatically to just over a quarter, around 31%. Most LICs only report adverse drug reactions, not the errors or near misses.
Which means a vast amount of potential learning from medication errors is simply being missed, especially in resource-limited settings.
Precisely. A huge missed opportunity to improve safety.
Okay, let's move to another major challenge: healthcare-associated infections, HCAIs, and the related rising threat of antimicrobial resistance, AMR.
Yes, HCAIs pose a very significant threat to patient safety, particularly in low and middle income countries, where the risk of acquiring an infection during healthcare is actually twice as high as in higher income settings.
Twice as high. And these infections obviously lead to longer hospital stays, more suffering, and significantly increased healthcare costs, too.
Absolutely.
But there's some brighter news here, right, about national programs.
There is. About 6 out of 10 countries already have national infection prevention and control IPC programs fully in place, and another 30% are currently developing them.
So progress is being made.
Definitely. The European and Eastern Mediterranean regions seem to be leading the charge here, according to the data.
Now, what's particularly insightful is this push for a multimodal strategy for actually implementing IPC. What does that mean exactly?
Multimodal means it's not just one thing. It includes system changes, like having enough hand hygiene stations. It includes education and training for staff. It involves monitoring practices and giving feedback, using reminders in the workplace, and importantly, fostering a strong safety culture where IPC is everyone's responsibility.
A whole package of interventions.
Exactly. And while nearly all countries, 91%, have national IPC guidelines on paper,
Yes.
only about half actually implement them using this comprehensive multimodal approach.
So guidelines exist, but comprehensive implementation is lacking for about half.
That seems to be the case. And another gap. Despite almost every country having a policy for in-service IPC training for current staff, fewer than half have a standardized national curriculum for it. That could limit consistency and effectiveness across different facilities.
Right, ensuring everyone gets the same core training. And tracking these infections, surveillance is absolutely critical too, I assume.
It's fundamental. Just over half of countries, 51%, report having active and reliable HCAI surveillance systems.
And what are they tracking mostly?
Globally, surgical site infections, or SSIs, are the most frequently reported HCAI category.
Okay. But Are countries setting targets to reduce these infections?
That's another area for improvement. Less than 40% of countries, only 38%, have actually set national targets for lowering their HCAI rates. Without targets, it's much harder to measure progress and drive improvement effectively.
Yeah, what gets measured gets managed, as they say.
Pretty much. So when we put this all into perspective for IPC, it shows that while many foundational elements, guidelines, some training, some surveillance are often present, the depth and consistency of their implementation vary widely across the globe.
Okay, let's switch gears slightly and talk about the safety of medical products themselves. Things like devices, medicines, blood, and vaccines. Here's a stark fact from the sources. Substandard and falsified medicines are a serious, deadly threat.
They really are. One WHO study estimated that about 10%, 1 in 10 medicines in low and middle income countries are substandard or falsified.
1 in 10, that's terrifying.
It leads to tragic, preventable outcomes. For instance, an estimated 250,000 deaths from tuberculosis treatment failure alone due to poor quality drugs, and somewhere between 72,000 and 267,000 deaths just from falsified anti-malaria medicines in sub-Saharan Africa each year.
Those numbers are horrifying. It really begs the question, how are we combating such a pervasive and deadly issue?
Well, strong national regulatory authorities are absolutely key. They're the gatekeepers. Our sources indicate that about three-quarters of countries, 72%, have comprehensive policy and regulatory frameworks covering these essential medical products.
Three-quarters sounds okay, but
But again, the comprehensiveness of these frameworks varies. High-income countries and those in the European and Western Pacific regions tend to have more inclusive systems that cover more types of products and safety aspects.
right. And it's fascinating how global systems also play a crucial role here, isn't it? Especially for medicines.
Absolutely. For medicines, almost all countries, 94%, have pharmacovigilance systems in place to monitor drug safety after they're on the market.
Like the WHO program.
Exactly.
Yeah.
The WHO Program for International Drug Monitoring is a prime example. Its global database, Vigibase, has collected over 35 million reports of suspected adverse reactions. This huge data set helps detect potential safety hazards that might not be obvious from smaller national data sets.
That's an amazing resource. But is the information getting back to where it's needed?
That's the limitation.
Yeah.
The full impact of this data is somewhat restricted because only about 2/3 of countries actually share this aggregated safety information effectively with manufacturers and, importantly, with healthcare providers on the front lines.
So the data exists, but the communication loop isn't always closed. What about blood safety?
Similar picture to some extent. Nearly 80% of countries have functional hemovigilance systems. These are designed specifically to monitor and improve transfusion safety. But again, these systems are generally more robust and functional in high-income countries.
And vaccines, obviously critical.
Very critical. And the good news is almost every country has immunization safety systems and national committees to review adverse events following immunization, or AEFIs. About 70% submit reports of serious AEFIs to that same global Vigibase database.
70% sounds pretty good.
It's good, but reporting rates for these serious AEFIs still vary significantly between countries, suggesting some underreporting might still be occurring.
Okay. And finally, medical devices. Often complex technology.
Right. For devices, about half of all countries, 49%, have post-market surveillance systems to monitor their safety once they're in use. This is primarily concentrated in upper middle and high-income countries. Another third, 36%, are actively developing such systems.
So definite progress across the board on product safety, but still quite a ways to go, particularly in making these systems truly universal and fully functional everywhere.
That sums it up well. Progress, but uneven.
Now, something that's often overlooked, but our sources really strongly emphasize it, is patient safety in primary care and during those transitions of care.
Yes, this is so important. While hospital care tends to get a lot of the spotlight, remember that figure you started with. Up to 4 out of 10 primary care patients might experience harm.
4 out of 10. It bears repeating.
It does. And the scale of this harm is comparable to the burden from certain common cancers in industrialized countries, or even diseases like typhoid fever in resource-constrained settings. Given these staggering numbers, it's really worth asking,
Yeah.
are we dedicating enough resources and attention to safety in this truly critical area of first contact?
it seems like maybe not enough. And those transitions of care, those crucial moments when patients move between different settings, like from hospital back home or from a primary care doctor see a specialist, they are inherently high-risk situations.
Extremely high risk. Communication breakdowns are common.
And despite that, the data shows that while three-quarters of countries have actually developed standard operating procedures, SOPs, for safe handovers.
Which is good, having the procedure.
Right, but only about a quarter have actually implemented these procedures in the majority of their health facilities.
Only a quarter implementing the SOPs they developed. That's a huge implementation gap, isn't it? A major vulnerability.
It really is.
It's also interesting to note that only about 40% of countries have implemented evidence-based clinical pathways for diagnosis, treatment, and referrals within primary care itself.
Just 40% using evidence-based pathways.
But what's perhaps a bit striking here is that lower-income countries, LICs, are actually doing relatively better in this specific area compared to some middle-income countries.
Really? Why might that be?
Well, one hypothesis is that perhaps they see strengthening primary care pathways as a more cost-effective approach to managing common health issues prevalent in their populations. And they may also be benefiting from more targeted international support focused specifically on primary healthcare systems.
That's an interesting nuance. What about formal quality assurance in primary care, like accreditation?
That's another area lagging behind. Only about a quarter of countries, 26%, have formal certification and accreditation programs widely implemented in their primary care settings. And again, there are significant regional variations in that figure.
So it really underscores a global challenge in comprehensively integrating safety measures into primary care, doesn't it?
It absolutely does. While two-thirds of countries report having implemented at least one specific patient safety intervention in primary care, maybe incident reporting or some training or family engagement.
So they're doing something.
Yes, but only a small fraction, about 17%, have adopted a truly comprehensive approach that covers all these essential elements systematically.
17%, a
Yeah.
long way to go for comprehensive primary care safety. Okay, finally, let's touch on patient safety and mental health services.
Yes, another area highlighted in the sources. Mental health treatment settings are also susceptible to various types of errors and adverse events.
Such as,
Things like medication errors, which we've discussed, but also inadequate monitoring of patients and managing the inherent risks of self-harm or harm to others in some cases.
so how are countries doing in implementing safety measures here?
Globally, it's quite low. Only about a quarter of countries are actively implementing specific patient safety interventions in their primary mental health care facilities.
Just a quarter again.
High-income countries generally lead, as you might expect. But interestingly, lower middle-income countries, LMCs, actually surpass upper middle-income countries, UMCs, in this particular area.
That is interesting, similar to the primary care pathway finding.
It is. It suggests, again, that factors beyond just national income level, perhaps specific health policies focused on mental health, or maybe international collaborations and donor support, can play a significant role in driving progress in mental health safety.
Fascinating. Okay, so we've covered a lot of ground. What does this all mean for us? Taking a step back, our deep dive into the safety of clinical processes reveals, I think, a truly global effort. It's this complex tapestry, isn't it? Progress interwoven with some really persistent challenges.
Definitely a mosaic.
From the intricacies of medication safety and infection control to the, as we've seen, often underestimated importance of primary care and mental health. Patient safety truly is a multifaceted endeavor. It touches every single part of the healthcare journey.
Yeah, and when we connect all these different threads, it becomes really clear that while governments and health systems worldwide are making strides, they're developing strategies, they're implementing programs, there's still substantial work to be done.
Where specifically?
We need consistent, comprehensive implementation across all regions and all income levels, particularly in those areas that keep coming up as lagging: diagnostic safety, primary care safety, mental health safety, and those transitions of care. The numbers clearly show us where the gaps are and therefore where the focus really needs to be.
Absolutely. And we've seen how a deceptively simple tool like the WHO Surgical Safety Checklist can make a tangible difference.
Tangible benefits.
But also that achieving true, sustainable culture change in healthcare requires so much more than just a checklist. It needs systems, leadership, training, the whole package.
Exactly. Culture change is complex.
We've explored the huge ambition of the Medication Without Harm Challenge and the ongoing difficult fight against healthcare-associated infections and that pervasive threat of substandard and falsified medical products.
And all of this, I think, raises a really important question for you, the listener.
Go on.
Given that patients and their families are explicitly identified as a key domain in medication safety, and we know patient engagement is crucial right across all areas of safety, what role can you actively play in ensuring safer healthcare for yourself and for your loved ones?
That's a great question for people to consider.
Think about that 5 moments for medication safety tool we mentioned. It's a powerful, practical starting point. It really is about empowering yourself to be an active, informed participant in your own care. Don't be afraid to ask questions.
That's excellent advice. The journey to safer healthcare is definitely ongoing, and it's one we are truly all on together, patients, providers, policymakers, everyone.
Couldn't agree more.
Join us next time on The Deep Dive for another exploration into the knowledge that truly matters.